1945, we're going to have the first woman, one of the first women to achieve sustained recovery in AA, Marty Mann. In 1944, is going to create an organization called the National Committee for Education on Alcoholism with a very simple idea. All she wants to do, this humble, young, early in her recovery alcoholic woman, is simply going to change how the country sees alcoholism and the alcoholic. She's going to convince this country that alcoholism is an illness, therefore the alcoholic is a sick person, the alcoholic can be helped, the alcoholic deserves being helped, and in those years she said alcoholism is our #4 public health problem and deserving of public support. Meaning, it's time the federal and state governments begin to allocate money to set up treatment systems, and she was saying, it's time we begin to move this person from systems of punishment and control to systems of care. 1944. It's going to take those recovery advocates she creates around the country through the 1940s, 1950s, and 1960s to lay the groundwork, starting in 1970 with new legislation for the birth of modern addiction treatment. We're going to see, if she's going to do that, then we have to have replicable treatment modalities for this if we're going to spread this national treatment system. And those modalities are going to come in a couple of ways. On the alcoholism side, they're going to come through an outpatient model of treatment pioneered at the Yale clinics in Connecticut, at Yale University. The Yale, most of us today think of Rutgers School of Alcohol Studies. Preceding that was the Yale School of Alcohol Studies, and the clinic system they set up also began to hire some of the first recovering people as lay therapists to work and run these outpatient models. We had a residential model emerge in the state of Minnesota in 1948, 49, and 1950 with 3 facilities. What were they? Hazleton, Wilmer State Hospital, Pioneer House. And in the interaction between these 3 facilities is going to create a very unique model of residential treatment of alcoholism that will in the modern era be called 12-step facilitation. And that model is a model that can be replicated in community after community. So later we're going to see a virtual army of people around the country and world traveling to Minnesota and basically stealing everything that's not nailed down and going back to their local communities to replicate it. And I know because I was part of the army going there in 1973 and 74. Now, on the, we also have this problem with the chronic public inebriate. And for that, we're going to go to Canada, and we're going to take a social setting detox model that's emerged in Canada. And all of a sudden,